Psychopaths with a Eugenics program. The Republican Party is getting scarier every day. Check this out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. This is from OutbreakObservatory.org, by the way, the really in-depth, deep dive into what Vietnam is doing. Screenings for COVID-19 amongst passengers at airports began on January 11th of this year. Now, keep in mind, we didn't have our first diagnosed case until January 20th. Neither did South Korea. They started screening at their airports on January 11th in Vietnam. That was the day after China announced their first death. And then also on January 11th, Vietnam imposed a mandatory quarantine, a mandatory 14-day quarantine, which they enforced on every single person coming into the country. The health ministry convened a response strategy meeting with the World Health Organization and other partners on January 15th. And on January 15th, Vietnam closed their schools nationwide. They put in place, they called it a national response plan. They put together a national steering committee on epidemic prevention. All of this was done before the end of the month of January. In February and March, they restricted flights even more vigorously and quarantined all international arrivals. In late March, the country suspended entry for all foreign international arrivals. So by the end of March, Vietnam was not letting anybody into the country who wasn't already there. They put into place local lockdowns. Communities had 20 days lockdowns, not 14. But it worked. They've killed the virus. They haven't had a new case in a week or two. Schools have been open since May, early May. The schools in Vietnam have been open for 2 months now. They still enforce strict mask usage, strict social distancing, and they're aggressively, anybody who comes in from outside the country has to be quarantined and all this other stuff. But they're doing good. They've reopened their country, at least internally, and the International Monetary Fund says, quote, Vietnam will face milder economic impacts from COVID-19 compared to other countries in the region due to leaders' early and aggressive response. The way that they did it nationwide, contact tracing was an extensive initiative supported by 16 provincial centers for disease control, 700 district-level centers for disease control, that would be like counties in the United States, and over 11,000 community health centers. The public was also recruited. They had newspapers and television ads. Cases of confirmed cases were traced and tested up to 3 degrees of separation. So they traced the case, they traced that person's contact, they traced that person's contacts of contacts, and they traced the contacts of those contacted persons. 3 degrees of separation. They've used the language of a country at war against a virus to consolidate support. There have been mass texts to mobile phones telling people wear your mask, street posters, press and social media posts, websites and hotlines, and then they rolled out a viral song telling people the wonders of wearing a mask. This all in Vietnam. Meanwhile, we've got, we're pushing 140,000 dead Americans, heading toward 250,000 by the election. And yesterday, Robert Redfield, according to ABC News, he told the Journal of the American Medical Association, day before yesterday, on Tuesday, that if everyone in America just wore a mask and social distanced, right? We don't need no stinking drugs. As I said earlier, Vietnam figured out it's a poor country. They figured out it was a hell of a lot easier to prevent COVID-19 than to treat it. And Robert Redfield said to the Journal of the American Medical Association, quote, the face coverings are, quote, the most powerful weapon we have, along with being smart about social distancing. Quote, if we all rigorously did this, we really could bring this outbreak back to where it needs to be. He says, I think if we can get everybody to wear a mask right now, I really do think that over the next 4 to 6, 8 weeks, we can bring this epidemic under control. And then he went on to say the fall and winter of 2020 and 2021 are going to be probably one of the most difficult times we've experienced in American public health. Why? because the Trump administration wouldn't do anything. Why wouldn't the Trump administration do anything? Well, that's a damn good question. Is this a Republican eugenics program? Is it because they read all those articles? Is it because they're just crazy? I mean, 2 days ago, I shared with you a study from one of the psychology journals that people with basically low IQs, they called it low cognitive ability, were more likely to refuse to wear a mask. Now one comes out, this was just published yesterday in the journal Social Psychology and Personality Science. The headline from Eric Dolan's piece over at SciPost.org, psychopathic traits linked to non-compliance with social distancing guidelines and mask wearing amidst the coronavirus pandemic. This was a survey of 502 U.S. adults done between March 20th and March 23rd. They asked them how often they complied with social distancing and mask wearing, and then they asked them a battery of personality tests. And what they found was that people who scored higher on the psychopathic subtraits of meanness and disinhibition tended to show less interest in social distancing and hygiene, and they were more likely to touch or sneeze high-use surfaces in public. Amazing.
You're listening to the Thom Hartmann Program. Call 202-808-9925.
So are these guys psychopaths, or do they have a eugenics plan, or are they psychopaths with a eugenics plan?